Hello, I'm Dr. Fraser Hale, board-certified veterinary dental specialist practicing in Guelph, Ontario. As well as providing clinical care to pet dogs and cats, I've also had the pleasure and privilege of attending conferences local, regional, national, and international to share my thoughts and experiences with regards to veterinary dentistry. As I record this in the spring of 2020, our world has become much more virtual, and it seems unlikely we'll be able to get together in large venues anytime soon. So rather than having my presentations languish on my hard drive where they do nobody any good, I've decided to commit several of them to video and share them as virtual lectures on YouTube. To get into the mood, I've even put on the tie that I like to wear when speaking to live audiences. This is my lecturing tie, my speaking tie. So I'm dressing for the part today. The first presentation I'm going to offer is entitled Intra-Oral Dental Radiography. Why is it essential? I'll start off by explaining my reasonings and logic behind the statement that intraoral dental radiographs are essential for all veterinary dental patients. And then we'll look at examples drawn from my case files, examples of animals who had pathology that was only going to be accurately assessed with radiographs, and how having those radiographs allowed me to make the right decisions for the animals and provide optimum care for the best possible outcome. So I hope you enjoy this presentation, and we'll chat a little bit at the end as well. Thank you very much. Intraoral dental radiography. Why is it essential? Before I get into that, I'll mention that on my website at toothvet.ca, on the Old Cusp Articles page, I have a number of papers that pertain to issues regarding dental and oral care in dogs and cats. Many of the slides in this presentation introduce concepts that are explored in greater detail in papers on that page. So when that happens, when there's a paper that pertains to a topic raised by a slide, at the bottom of the slide I'll put a little text box like this, and it'll have the name of the section on the Old Cusp Articles page where that paper is found, and the name of the paper, the link that you're going to click on in order to find that paper if you want to explore those concepts in greater detail. Now, I'm about to make a rather bold statement, and before I do, I should mention that I have no authority or jurisdiction over veterinarians. I'm not a disciplinary body, I'm not a licensing body, I'm just a practicing veterinarian with my very firm and informed opinion, but I have no authority over any veterinarian. Having said that, it is my firm opinion that if you're not able to obtain and properly interpret diagnostic intraoral dental radiographs for every patient, you should stop offering dental services until you are able to do those things. Why would I say that? That's a rather harsh and bold statement. Well, every treatment plan is based on an accurate assessment of the problem. The vast majority of every tooth is hiding from view within the bone of the jaws, hidden from view from the naked eye. The entire contents of the tooth is hidden from view inside the tooth. The supporting bone around the roots of the teeth are hidden below the soft tissues of the oral cavity. So the vast majority of the tooth, the inside of the tooth, the root structure, the bone around the teeth, all of those things are hidden from view to the naked eye and require diagnostic imaging for you to be able to evaluate them. And without intraoral dental radiographs, therefore, you're going to underdiagnose or misdiagnose a large number of your patients. With an inaccurate assessment, your treatment plan will be inappropriate. Yes, you will find some disease, some obvious disease. You will get some of the low-hanging fruit, but you're going to leave a lot of pathology undiagnosed and therefore untreated. And the animal will go home with that pathology still in place and still suffering in silence. There are many areas of veterinary medicine where taking a radiograph or getting diagnostic imaging, whether it's an ultrasound or some other imaging, is just understood that as part of the diagnostic evaluation for this problem, we are going to need diagnostic imaging. And we have to have that same association between imaging and dentistry, that if there's a dental problem, we need imaging. Even if there isn't a known dental problem, we need imaging to determine whether or not there are hidden problems. Dental radiography, and there's a paper here, see, miscellaneous topics, just say no to bad medicine. So that's the name of the paper that pertains to this slide. Dental radiography or radiology, it's not a luxury. It's not particularly expensive. It's not technically difficult. Yes, there is a learning curve. It's steep, but it's not very high. I can train somebody who's never taken a dental radiograph, if they, with some hands-on training and some practice, within 2 to 3 hours, I can have them taking diagnostic intra-oral radiographs on dogs and cats quite confidently. So it's not difficult to learn. It's certainly not just for the dental experts. We'll sometimes hear general practitioners say, well, all you do is dentistry. Of course you're going to be taking radiographs. But in general practice, that's not practical for us. But I don't understand really how if a specialist with years and years of extra training and focus just on dentistry, if we can't make an accurate assessment without these images, how could it be that a general practitioner with less training and with less focus on dentistry would be able to make an accurate assessment with less information than the experts require? It doesn't make sense to me. And so I don't think dental radiography should ever be considered an optional extra, something that the owners get to choose whether they do or do not consent to having radiographs taken. For me, it's a mandatory part of every procedure. And if an owner were to say, no, I don't want any radiographs, then I would have to say, I'm sorry, I can't treat your patient. I can't accurately assess it without radiographs. Therefore, I can't appropriately treat it. And I'd rather do nothing than do the wrong thing. And that comes down to the just say no to bad medicine that I was referring to. So dental radiography, it is absolutely essential. And we'll look at examples of how that is so. As I mentioned, it's relatively easy to learn and do. It takes some training. But if you get some good training at the outset and develop good habits, it's really not a challenging thing to do. It's not a particularly expensive discipline to get into as far as the purchase of equipment, and it can be profitable very quickly after obtaining the equipment and the training. You will be turning a profit from the radiographs, and that will help pay for the other toys in the practice that don't turn a profit. And it's not just that taking the x-rays turns the profit. It's really when you take the x-rays, you find pathology. When you find pathology and can accurately and communicate the significance of that pathology to the owners, they're going to give you informed consent to treat those problems, and then you can charge for that treatment, and so it generates income. Even if you were to charge nothing for taking the radiographs, it would still generate income by finding pathology that then you treat. It's going to be a medical legal obligation that you have these images as part of your medical records, and it's rapidly becoming, I put standard of care in quotes because it's kind of a nebulous term, but it's becoming that. Yes, there are limitations to radiography. Radiographs are 2-dimensional, patients are 3-dimensional. They only show shades of gray indicating the relative densities of the tissues. It doesn't show the soft tissues. It doesn't show the character of the soft tissues. It doesn't show inflammation, for instance, or whether there's gum recession. So we must always correlate the radiographic findings with the clinical findings to get a true sense of what's going on. We need all the pieces of the puzzle. And I would say when it comes to dental and oral concerns, skull radiographs are often worse than useless in that with so many overlapping structures, skull radiographs tend to hint at problems that aren't there and hide the problems that are there. So they not only fail to show us what is going on, they suggest that things that aren't going on. So as I say, worse than useless, and rarely is it going to be worthwhile taking skull radiographs if the concern is a dental or oral concern. But let's get back to the value of dental radiographs. I have literally thousands of cases in which the presence of diagnostic radiographs were the difference between me making a bad decision and a good decision for the patient. When you take radiographs, you find pathology. You can then communicate that pathology. You can show it to the owner so they understand what it means and why it requires treatment, and then they will give informed consent, and you can treat the animal, and then you can charge a fair fee for having done that. So it generates income for the practice, but also it treats the animal better. It gets the animal the treatment it needs to enjoy a mouth free of pain and infection. So that's good for the pet, and really that's good for the owner because it ultimately the owners want their animals to be comfortable and healthy, and so they want the pathology found and treated. And we'll sometimes hear economics listed as a reason for not having radiographs, that our practice can't afford it, or our clients won't pay for radiographs. And a lot of that is it's false economy, in that if a practice isn't taking radiographs, they're not finding the pathology, therefore they're not treating the pathology, therefore they're not charging for the treatment of the pathology, and they're letting those opportunities walk out the door. So they're not realizing the full potential of the dental procedures that they're taking. They're not generating the income from those cases that is available to be generated. Also, the animal isn't being properly treated, so the problem doesn't resolve. So a lack of radiograph leads to poor evaluation or assessment of the problem, which often leads to ineffectual treatment, which means the problem persists and goes on to continue to be a source of problems for the animal and a requirement for further testing and treatments until a diagnosis is made. And I've seen many cases where a great deal of money has been used ineffectively or inefficiently, trying to come up with a diagnosis and a treatment plan, when radiographs would have got the answer very quickly and saved everybody a lot of time and frustration and, more importantly, money. So radiographs increase the revenue for the practice, but it also decreases the amount of money that owners waste on ineffective treatment. So lack of radiographs, less income for the practice, more wasted expense for the owner. So that's the carrot in this analogy. And then the stick is that if a case goes to complaints, it's going to be far harder to defend your actions or inactions if you don't have good documentation of the problem as presented and how you treated it. And intra-oral dental radiographs are a very important part of that documentation that can help a complaints committee understand what you were faced with, what you did about it and why the outcome may not have been to the owner's satisfaction. So that would be the stick portion of this analogy, that not having radiographs is going to make it more challenging for you to manage any complaints that might be lodged against you. Standard of care, well, as I say, it's kind of a nebulous term. There's no specific definition for it, but I would say that it's always a moving target. And in regards to dentistry, it is moving towards intraoral dental radiographs as being mandatory. So the winds of change are blowing. You can tie yourself to a tree or build yourself a kite. You can dig your heels in and say, I've been practicing for X number of years without radiographs and I've been fine, so I'm going to continue to do it that way. That's tying yourself to the tree. Or you can get on board, start taking radiographs, and enjoy the view from above. This would be a really good book for you to get, by my friends Greg DuPont and Linda DeBose. It goes over materials and equipment required, technique for getting the radiographs, but also talks a lot about interpretation of the images. And you can see here on the cover how there'll be a radiograph, an example of a radiograph without any embellishments, and then line drawings overlaid on top of the radiograph with labels to show you what it is you're seeing, and then a cutaway of an actual skeleton so you can see the tissues as they would appear in a specimen. So I encourage you to get that book and have it handy for frequent reference. So now we're going to look at some cases that benefited from having radiographs. And this was a cat that had extraction, note the quotes, of its lower canine teeth in the fall of 2014 and was presented to me in the spring of 15 with left mandibular swelling in this area. And when we get our x-ray, it's pretty clear why that happened. You can see that the lower canines were not extracted, the crowns were removed and the roots were left behind. And there was persistent infection at least around the left root, because there's bone loss down here around the root tip and the tooth is migrating up the socket and about to break out through the gingiva. In fact, it may already have a fistula with some pus draining there. So now we have a diagnosis. We have retained roots as the source of the problem, and we do the surgery to remove those roots and close the wounds, and obviously remove the incisors as well. And now we have resolution of the problem. And so radiographs to the rescue. Now, there is a paper on the website, Uncomplicated Crown Fractures, and it pertains to this slide. Here we have a dog with fractures or a little bit of damage to the tip of each of the carnasial teeth, the right upper fourth, left upper fourth premolars, the left first molar, and the right first molar. And they all have about the same amount of damage. There's enamel loss and exposure of the dentin and staining of the exposed dentin, but there was no actual pulp exposure, no hole that I could stick an instrument into to get into the pulp chamber. And so we see these sorts of this sort of coronal damage on dogs' teeth very, very commonly. And I think oftentimes general practitioners are inclined to think, if I can't get an instrument into the pulp chamber, there's no problem, no worry, nothing to be done about it. But we really need radiographs to have more confidence in making that assessment. So we haven't really been talking about radiographic interpretation yet, and I'm not going to go into that, but I'll just say, here's the radiograph of the right upper fourth premolar tooth, and I interpreted that as showing no radiographic signs of endodontic disease at this time. The left upper, same thing, radiographically normal. The left lower, radiographically normal, and then the left lower, guess what? Big areas of bone loss around the root tip of both of the roots of this lower molar. So what that tells us, when you see this sort of bone loss around the root tip, that is a lesion of endodontic origin or an apical lucency. The term I usually use for this is apical periodontitis. So we have periodontal inflammation or inflammation in the periodontal space around the root tip or the apex of the tooth, and that has caused demineralization of the bone. And this space is filled with inflamed soft tissue, an apical granuloma. So what's happened here is with the damage to the crown, exposing the porous dentin, bacteria have managed to get in through the porous dentin to cause contamination and eventual septic pulp necrosis. And then the bacteria have trickled out through the root tip to cause infection and inflammation around the root tips buried deep down inside the jawbone. There's no signs of that externally, but down inside the jawbone on radiograph we see significant bone loss. So this is a tooth that's dead and requires either root canal treatment or extraction. And because it's a big important tooth, and taking that out would have created a large wound that would have been challenging to get to heal, root canal treatment was deemed the preferred treatment, so that's what was done. There is a paper on what is root canal treatment. Here's the tooth immediately following root canal treatment in July of 2014, and here we have follow-up radiographs a year later showing nice resolution of those apical granulomas. And there's another value for radiographs for monitoring response to treatment. Did things get better, stay the same, or get worse? And in this instance, I'm happy to say things got considerably better with the treatment. This dog had a chronic ocular discharge, pus coming up through the nasolacrimal ducts or the tear ducts. And you push on the dog's face right here, you get pus squirting out through the tear ducts. This had been evaluated as an infection and treated multiple times with systemic and topical antibiotics. And this is one of those cases of false economy. For a long time, this dog was treated with drugs that had no chance of resolving the problem. And each instance, there was an office visit with a charge, and there was dispensing fees and the prescription, the cost of the medications, all of this racking up expenses for the owner and causing frustration, no doubt, for the owner and probably for the veterinarian as well. The problem was the fourth premolar. The right upper fourth premolar had an uncomplicated crown fracture with dentin exposure, and when we get our radiograph, we see quite dramatic bone loss around all three tips of the roots, or around the tips of all three roots. And the infection had gone in through the dentin, killed the pulp, out through the root tip, causing infection and bone loss around the root tips, and then it had fenestrated through the bone into the nasolacrimal system. So the purulent discharge was draining up through the tear ducts and making itself visible at the eye. But the problem was never with the eye. The problem was always with this tooth. And if somebody had taken a radiograph of that at first presentation, it could have been treated appropriately at the first instance and saved a lot of time and a lot of money for the owner. In this next one, we have a fractured canine tooth in a cat, and you may be now starting to think, well, the fractured tooth, it's going to require extraction. Why do we need an x-ray to make that decision? We already know the tooth is broken and is going to require treatment. Well, maybe this is a tooth that's a good candidate for root canal treatment, which would mean less trauma, less pain, no wound to heal, So many advantages to doing root canal treatment, but we don't know if this tooth is going to be a candidate or not until we get our radiograph. So preoperative radiograph first to decide. Now, maybe the owner has already said, you live in a place where the nearest person who can do a root canal treatment is 6 hours away, and they say, no, I'm not going to do that, just take the tooth out. So maybe we don't need an x-ray before we do our extraction. Maybe we don't need a preoperative x-ray. Except, if you don't have a preoperative x-ray, you don't have this information. The information that not only has the chronic infection going in through this fractured crown caused destruction of the root, it's also caused destruction of most of the bone around the root. So now you take that radiograph and realize that the tooth's got to come out. There's no change in that fact. There's no option but to extract that tooth. But you now know that in taking the tooth out, there's a very real chance that the jaw is just going to fall apart through the socket in this location. And it's better for you to know that before the jaw breaks, so you can get on the phone with the owner and explain the situation, and maybe email them a copy of the radiograph, or meet them on Zoom and show them the image and explain the situation. This is what we're dealing with. The tooth is fractured. It's got to come out. There's bone loss because of the chronic infection. There's a risk the jaw is going to fracture. If we proceed, do you want me to proceed, or do you want me to refer this and let somebody else deal with it? And that's a far better conversation to have with the owner before the jaw breaks than it is after you've broken the jaw and now you're having to explain, sorry, trying to get the tooth out, we broke your cat's jaw and now we have to refer. So preoperative radiograph to let you know what you're getting yourself into, so you can decide, are you going to manage this yourself, or are you going to refer it and let somebody else deal with it on your behalf? Here we have a 6-year-old Jack Russell Terrier who was referred for a problem at the front of the mouth, but when I looked around the rest of the mouth, I noticed that while I could see the lower first molar, I couldn't see the second molar. I could see what looked to be the third molar, and that's not normal. And a paper on the website entitled Dentigerous Cysts that you should have a look at, because here's what we found when we got our radiograph. The second molar was present, lying down in the jaw like so, and was never going to erupt. And what we were seeing through the gum was in fact the third molar. Now, an unerupted adult tooth is very inclined to have a cyst form around the crown, a fluid-filled balloon that expands within the bone. And as these dentigerous cysts form, they destroy the surrounding bone, and that can involve the bone that supports the roots of adjacent teeth. So it wouldn't take much of a cyst here to destroy the bone and compromise the health or the root of this large and valuable first molar. Also, by the time you see evidence of a cyst back here, there'd be enough bone loss to have significantly weakened the jaw that we could even get a pathologic fracture of the jaw and very little bone left to put back together. So taking a wait and see, or I will monitor this at home, that kind of approach is not medically appropriate. If there's the apparent absence of a tooth, we must radiograph to determine whether the tooth is missing or hiding, and if the tooth is missing, we must get it out before it has an opportunity to form a large destructive cyst. Because here's what happens if you don't do that. This was a 5-year-old male neutered boxer who apparently was missing its lower first premolars, and if that had been noticed when the dog was under anesthetic to be neutered, those teeth could easily have been removed then, and there would have been no long-term consequence and very little disfigurement, just the loss of 2 teeth that hadn't erupted and were therefore functionally absent already. But they weren't radiographed and they weren't removed, and at the age of 5 we have these very large cysts. The one on the left much larger than the one on the right, much more obvious. You can see this very large fluid-filled hole in the bone that has destroyed the support for the lower canine, and the second and third premolars, and the cysts on the right side, a little less distinct radiographically, but again a very large cyst that had formed on the right side as well. So because of a lack of a couple of radiographs when the dog was neutered, these cysts were allowed to form and cause quite a lot of bone destruction. Surgery is going to result in loss of the canine teeth and the incisors. You can see the cyst is up, involving the incisor roots as well. And also this jaw has become quite compromised. The amount of bone loss has created a weak spot in the jaw where it could break under fairly minor stress. So fortunately we caught it before the jaw broke, but a very preventable problem by taking radiographs at an appropriate age, at 6-7 months of age, for all apparently absent teeth. And in boxers, because they're so prone to having supernumerary teeth, which sometimes don't erupt, even if it appears that a boxer has erupted all 42 teeth, they should be radiographed to make sure that there aren't any unerupted supernumerary teeth. This is the sort of case that the things I've shown you up to this point are fairly common. I see them all the time. This Lulu was just an extreme example, and I hope to never see another case like her. None of her baby teeth erupted, none of her adult teeth erupted, and so we have large cysts throughout her mouth, and here are her radiographs just for fun, where you can see a multitude of permanent and primary teeth embedded within the jaw and large cysts around them and very little bone to deal with. But we were able to get all the teeth out without having the jaws break, and Lulu did quite well after that. Paper on the website, Focus on Micro Dogs, talks about the deformity of this molar that we're looking at here in this little 4-year-old toy poodle. There are people working on coming up with an official name for this deformity. For now, we're just calling it dilacerated molar. Dilaceration means bent. And when we look at the radiograph, the crown of that tooth looks a little bit odd, but the radiograph looks very odd in that those lower, the roots of that lower first molar, they should be divergent. And in this instance, they're converging and in fact overlapping at the root tip. And this condition is usually associated with a hole directly into the pulp chamber right at the frication. So early on, bacteria can get down through the gum line into the frication, get inside the tooth into the pulp chamber, cause septic pulp necrosis. Then the bacteria comes out through the root tips, causing infection and bone loss around the root tip. And we can see quite a large hole in the bone there from the chronic infection. And in order for there to be enough bone to show up that dramatically on x-ray, this has been going on for a very long time. This dog's had pain down there for months and months. On the left side, we see that the same situation. We don't have quite as dramatic bone loss, but the same deformity. And this condition is almost always bilateral. The first time I diagnosed it, it was unilateral in a mature Pomeranian, but every other time I've seen it, it's been bilateral. And more commonly in small dogs, but I've certainly seen it in larger dogs as well. For instance, here we have a 9.5-year-old lab cross. It had had a dental procedure done by its primary care veterinarian the year prior. No radiographs had been taken at that time. The crown of the right lower first molar looks pretty darn normal. Gum tissue looks fine. Nothing there to suggest that there's any pathology with this tooth, but I did notice a small draining fistulous tract right at the mucogingival junction that I was able to stick a soft rubber probe into. On the left side, the crown of the tooth looks a little bit odd, but there were large, obvious draining tracts at the mucogingival junction. And when we get our radiographs, we'll see what's going on. On the right side, there's a large area of altered bone architecture around the root tips. This is what I would refer to as condensing osteitis, where there's not so much bone loss around the root tip, but change in the character of the bone right adjacent to the roots and then surrounded by a halo of even denser bone. And this is the result of chronic inflammation around the root tips. Now, note the pulp chamber size in this lower first molar on the right. The pulp chambers are fairly small. Now, one thing we know is that when the teeth first erupt, their pulp chambers are huge, the walls of the teeth are very thin, and as long as the pulp in the tooth is alive and time is going by, the pulp chamber is getting smaller as the wall of the tooth is getting thicker. But if the pulp dies at some point, then whatever size the pulp chamber is at that moment, it never gets any smaller than that. So this tooth on the right side has relatively small pulp chambers. This tooth survived for many years before succumbing to its deformity. But then with the changes around the root tips so obvious on radiograph, this pathology has been going on for many, many months, if not years. But then when we look at the right side, at the left side, the size of the pulp chamber in this lower left first molar, the pulp chambers are massive, indicating that the pulp in this tooth died likely before this dog was a year of age. So this dog has lived virtually its entire adult life with chronic pain and infection around this dead and deformed lower left first molar. And there were opportunities to discover this and alleviate it so that this dog didn't have to suffer until it was 9.5. At the very least, a year of suffering could have been prevented if a year prior the veterinarian had radiographed this tooth, determined or diagnosed that pathology, and extracted the tooth then. So another case where lack of radiographs allowed a problem to persist longer than it should have, to the detriment of the patient. This dog had some enamel hypoplasia visible on the crowns. There is a paper on that. Also had a persistent primary canine tooth. Now, oftentimes with these enamel defects in young animals, it is just restricted to the crown of the tooth. But I've seen a number of cases where the deformities also affected the root, or that the deformities on the crown hinted or indicated that there may be serious developmental problems with the roots. As in this case, when we get our radiographs, we see that some of the teeth have virtually no root structure whatsoever, and even those that do have very diminutive roots. This is the upper canine tooth, and its root should be twice the size of the crown, and in this instance, the root's not even as big as the crown. So this dog, virtually all of its teeth had underdeveloped and deformed root structures and required a great deal of extractions. The teeth really had no future, no chance of staying healthy or being functionally useful for the dog. So in order to provide the dog with a mouth free of pain and infection, many of these teeth were removed. But we don't know what's going on below the surface until we get our radiographs. Periodontal disease is the most common health concern in pet dogs and cats. Not just the most common dental concern, but the most common health concern. There is a paper on this concept of periodontal disease being a hidden disease. What we see above the surface can be a very poor predictor of what's really going on when it comes to periodontal disease. And this example, I use this example very frequently, and you might think, oh, that's the only time he ever saw it, so he keeps going back to these same images. And that's far from the case. I've seen many, many examples of this where a tooth looks quite normal above the surface, and then when we get our x-ray, we see that there's considerable disease below the surface. So the crown of this tooth, no tartar buildup, the gum tissue, no gum recession, no inflammation, nothing visually to indicate that there was any disease with this tooth, and yet massive pocket of periodontal disease encompassing the entire distal root, allowing bacteria to get in through the root tip, kill the pulp, go through the chamber, out through the root tip of the mesial root, and cause bone loss due to endodontic disease at the mesial root. Now you might say, oh, with a pocket like that, we would have found this without x-rays. As we probe around the teeth, our probe would have dropped down into that pocket, and we would have known that this tooth was diseased and required extraction. But it's going to be so much easier for you to communicate the significance of this disease and the need for treatment if you can show the owners the radiograph. Show them a normal radiograph of this area, show them that radiograph, and now they can see why this large, important tooth requires extraction. It really, really helps with client communication to get informed consent for the necessary treatment to provide this animal with a mouth free of pain and infection. Very helpful to have these images, these radiographic images, to help educate and inform your clients. And without those images, it would be that much harder to help them to understand why that perfectly normal, healthy-looking tooth requires extraction. Here's another case of periodontal disease being hidden. This dog had had a procedure by its primary care veterinarian, and during that procedure they noticed a fractured lower molar directly below this tooth, so the dog was referred for me to treat that. Their notes had indicated that they'd found some pus under the gum line of this upper fourth premolar tooth, but that they thought it had cleaned up well. When I saw the dog just a few weeks later, I noticed, yes, the crown of the tooth was fine, the gum tissue didn't look too bad, but there were draining fistulous tracts at the mucogingival junction on the cheek side of the tooth, as well as a pocket up the palatal side, and I put those soft rubber probes into those. And here we get our radiographs, or our radiograph of the area, and it shows those probes going into the pocket well below the gum line, deep, deep up the root, almost to the root tip, and quite a lot of bone loss in the space between the roots in the furcation. And so this tooth that looked fairly good above the surface and that the primary care veterinarian thought had cleaned up well, had end-stage periodontal disease, clearly visible and demonstrated with this radiograph. You can see when we got the tooth out, quite a lot of mineral deposits on the root structure, but also it's being eroded and pitted by the chronic inflammation below the surface. Now, those have been things up to this point. I've been showing you things that we see very frequently, other than Lulu, that Shih Tzu with all of its teeth unerupted. This next one is a little bit more of an oddball. I've seen several of them in my career, but sometimes go a few years between having a case of what we're going to see in this dog, Lexi. So there's an unerupted or apparently absent adult canine tooth. And so unerupted tooth, you may be thinking dentigerous cyst. That's good if you're thinking that, but that's not what was going on with Lexi. She had a condition known as a compound odontoma. This is also one of the only cases where skull radiograph taken by the primary care veterinarian was actually useful. They took a lateral skull radiograph, and we can see in the nasal passage what appears to be a deformed adult canine tooth and a number of densities in front of it. And on my radiograph, intra-oral dental radiograph, there's the deformed adult canine tooth in the nasal passage and a multitude of tiny little densities, each one of which is actually identical, which is to say an abnormal tooth with all of the normal dental tissues in proper orientation. So each one of these little denticles had enamel covering the crown, dentin and cementum covering the root, and pulp chamber inside. These are fun little things because they're very dramatic radiographically. It's kind of like a dog with a bladder full of stones. It's a dramatic finding on radiograph. You do the surgery to remove the stones, or in this case to remove all the denticles, and the case is resolved. So they're kind of fun to deal with, very, very gratifying. So here's the surgical approach through the dental arcade, and we're up into the nasal passage. That's after having removed all of the denticles forward of the unerupted canine, and now there's the tip of the canine still visible. Because of this very dramatic curve in the root, it was a little difficult to tease it out, but we finally got it all out before closing the wound. And there's the canine tooth with its curved, deformed root, and there are all the denticles that were up this dog's nose. Cats, with their tooth resorption, they just cry out for radiographs. Here we have a normal lower canines and incisor and lower premolars and molars, so those two images are normal, and then the rest of them all show cats with tooth resorption. So many cats have developed tooth resorption in their lifetime. You just always have to assume that every cat you treat is going to have one or more tooth resorption or teeth undergoing resorption. Assume that they have it until proven otherwise. And there's a paper on the website, Tooth Resorption in Cats. Now, in some instances, the resorption has progressed far enough that we'll see it visually on examination. So this pink area here would be overlying the resorption on the side of the crown of that lower canine, and this lower premolar has a big defect in the crown. So those we're going to see above the surface. But resorption starts below the surface. If we're only treating the cases where it's gotten up onto the crown, then we're going to be missing a lot of pathology that's going on below the gum line, such as this canine here that has virtually no root left and a big hole that's just about to break through. And even this upper canine in the middle of the screen, quite a bit of resorption deep in the socket. And I wish I could say that resorption was only found in cats, but dogs can get it as well. And so we need to be radiographing dogs to look for tooth resorption in them. Yep, there's a paper on that on the website. What other indications or findings might we have on dental radiography? Well, we'll sometimes see a tooth whose crown looks perfectly normal, no evidence of damage or trouble with it. And then on radiograph, one or more roots may be fractured below the gum line, subgingival root fractures. You're not going to find that on clinical examination. You're going to find that with radiographs. We certainly want to use radiographs whenever we're assessing any intraoral growths or tumors. And even in an animal that has no dental pathology, it's good to establish a baseline, to have a set of radiographs that can document that on this date, everything was normal. This is what the animal's teeth looked like radiographically. And then you've got a comparator for all future radiographs, so that if you find something abnormal in the mouth 3 years later, you can go back and say, oh yeah, look, we noticed that 3 years ago, that hasn't changed. So it's whatever it is, it's probably not a problem. Or nope, that's a new finding that wasn't there 3 years ago. Something new has happened. It just gives you that much more information in order to interpret what you're seeing when you have previous radiographs to compare to. And having a set of radiographs with no abnormal findings, that's a very useful thing to have in an animal's record to be able to say that on this particular date, radiographs were taken and everything was fine, and then you can compare that to all future radiographs. Also, doing whole mouth radiographs in all of your patients makes you better at it. You get faster at getting the images and you get much better at interpreting them. These are learned skills, and the more you practice, the better you're going to get. Another important factor to keep in mind is that, unlike human patients, dogs and cats can't tell us if or where it hurts. So that means we have to be extra vigilant and diligent in looking for hidden oral pathology. And part of that investigation includes intra-oral dental radiographs. To have normal comparators to show to your clients when you're trying to explain to them on a radiograph, this is the pathology we're seeing, it's useful to have a set of normal radiographs to show this is what this tooth ought to look like, and now we're looking at your animal's tooth that shows the pathology. So on my website, under the Intra-Oral Dental Radiology section, there's a set of normal canine dental radiographs and a set of normal feline dental radiographs, and you're certainly welcome to use those to show your clients this is what the tooth ought to look like on radiograph, and this is what your pet's tooth looks like on radiograph, and it helps them to understand what you're getting at when you're trying to explain to them the findings. So the take-home message from all of this is that intraoral dental radiographs are absolutely essential for the proper assessment and treatment of every dental patient. I hope you've enjoyed this virtual presentation of my discussion on why dental radiography is essential. Do consider subscribing to my YouTube channel so you'll be notified when other lectures have been posted, and you're welcome to view all of the other videos that I've posted there as well. You can also make use of any of the resources I've posted on my website, toothvet.ca, particularly the Old Cusp articles page, but there's also some resources on the forms and handouts page and scattered elsewhere throughout the website. So I've posted them there. If they're useful to you, please do make use of them. And thank you very much for watching. Goodbye.